For people living with sickle cell disease, it can be really hard to get adequate resources when transitioning from pediatric to adult care.
People living with the condition in Georgia are pushing for some more education and some more access to resources. 11 Alive's Cory explains.
Growing up in Columbus, Georgia, Alexis Bartlett spent her life navigating the challenges of living with sickle cell disease.
They did not explain the risk factors to my mother of the potential of passing the disease to me. My father had sickle cell trait also.
Sickle cell is a condition that causes the normally round red blood cells to take on a crescent or sickle shape. This can cause painful episodes and other complications for people like Alexis. She says taking charge of her health care was not always easy as a child, and things got worse when she got older.
You encountered doctors and nurses who would ask you questions like, how long have you had sickle cell? And it's like, what do you mean, how long? It's the largest genetic disorder in the world.
Alexis says having doctors and nurses who didn't understand her condition made it difficult for her to get the care she needed. She now goes to Grady Memorial Hospital for treatment, and while she says her care has improved, she still has to travel more than an hour away from home.
The more educated the healthcare system that you are in, the better quality of life you have.
Expanding access to resources and education are at the heart of Cory Lewis's organization, the Red Moon Project.
And I just feel like that's important, but it's not really emphasized in most schools or most hospitals.
Cory started the organization when he had his own harrowing experience with a doctor. He now works with other health organizations and speaks to college and high school students so they can advocate for themselves when they walk into the doctor's office.
Do they understand what's really going on? Because yes, I'm telling you what I feel, but you're telling me something that is totally different that don't have nothing to do with me. And that's what happens with a lot of sickle cell patients in most cases.
He's hoping the Red Moon Project will help fill in the gaps about sickle cell disease and lead to better care for everyone. Cory, 11 Alive News.